Welcome, everybody, and welcome to the Disability Power Series hosted by Disability Lead. I'm Emily Blum, CEO of Disability Lead. I'm a white woman with brown shoulder-length hair. I'm wearing tortoiseshell glasses and I'm wearing an orange top. I have a physical disability, though that may not be visible in this virtual setting. We're so pleased that you've joined us today for our Disability Power Series, an annual program series featuring powerful disabled leaders and bringing together an intentional audience. Today's program includes ASL interpretation and CART services. While you can access auto captions right here in Zoom, we're also providing a stream text link in the chat where you can access CART in a separate browser. If you have any access issues or require assistance throughout the program, feel free to utilize the chat box to message DisLead support for assistance. This program is being recorded and will be available for public viewing in the coming weeks. Disability Lead's mission is powerful in its clarity. We increase civic engagement and build diverse leadership by nurturing and expanding a network of leaders with disabilities. At our core, we know that leadership is not a privilege reserved for a select few. It is a right, and it is essential to achieving justice, equity, and inclusion for disabled people everywhere. We make connections to opportunities for a network of over 250 disabled leaders, and we're absolutely thrilled to welcome some of our very own members as panelists in today's program, alongside our featured guest. I'm thrilled to invite our entire panel to join me on screen at this time. But before I introduce our panelists, I want to pause and acknowledge the moment we're in. I know our panelists share this message with me. Today's conversation is about the critical importance of disabled representation in healthcare spaces. But we can't talk about the future without being honest about the present. Across the country, enacted and proposed policies threaten to roll back benefits, freedoms, and the very ability of disabled people to live independently. This includes access to health care and the medical resources that we rely on. These attacks are a stark reminder that rights are never guaranteed. They must be defended. Our community deserves more than survival. We deserve the chance to thrive. That's why the leadership of disabled people is not optional, it is essential. The movement for disability justice depends on all of us, each in our own ways, showing up, speaking up, and leading. And that brings us to today's conversation. Our panelists are leaders who prove that when disabled people are in positions of influence, we reshape systems for the better. Their work shows what's possible when expertise, lived experience, and commitment come together. We are grateful for their courage, their persistence, and their vision, especially in a time when both are being tested. Now, please join me in welcoming our featured guest, Dr. Lisa Meeks, Professor of Medical Education at the University of Illinois College of Medicine and founder of the Docs with Disabilities Initiative. And Lisa is joined by Disability Lead members Katherine Vakil, Pharmacy Services Manager at Erie Family Health Centers, Dr. Zoie Sheets, Resident Physician at the University of Chicago, and Kruti Shah, Pharmacist at Oak Street Health, who will be helping to moderate today's conversation. Welcome, and thank you all for being here.
Thank you, Emily. Hello and welcome, everyone. My name is Kruti Shah. My pronouns are she, her, and I'm a South Asian woman with dark brown hair wearing a blue outfit. I am so thrilled to be here with the panelists today, who I am privileged to know from prior to this panel. I respect them so much, and it is truly an honor to be with them. We've got a lot to cover, and we really appreciate all the questions that were submitted beforehand because they are going to help us guide this fantastic conversation. To kick things off, I'd like to start by making space for each one of us to share a little bit more about who we are. We are all healthcare professionals, but we're also people with disabilities. So let's take a moment to share one way each of us are leading our disability identities in the healthcare space. I'll start with me briefly and then turn it over to Dr. Meeks, and then Katherine, and then Zoe. I am a clinical pharmacist specializing in inpatient psychiatry and transitions of care. My job is to help ensure medication regimen is safe and effective for my patients and avoid hospital readmission. My connection to disability is that I am hard of hearing. I was diagnosed with mild to moderate hearing loss as a child. For years, I managed it quietly, but it wasn't until 2020, when the pandemic hit, that my world was completely upended. Overnight, masks became mandatory. Lip reading that I relied on vanished. Suddenly, I felt isolated, insecure. I was struggling to understand my patients, my team. My confidence was shattered. In a moment of sheer desperation, I thought to myself, I can't be the only one dealing with it as a pharmacist, as a healthcare professional. So I turned to Google and started searching for healthcare professionals with disabilities. And guess what? I found docs with disabilities. Hearing the powerful stories of doctors and nurses and dentists, audiologists, and so many more professionals through podcasts of docs with disabilities, their real, raw experiences, their story was a lifeline for me. It was a moment of profound realization that I am not alone, that my struggles were not just my own, they were a call to action. After connecting with Dr. Meeks, who I emailed, and she invited me to share my story on Docs with Disability podcast. Through a network of leaders of Disability Lead, as well as ERG at my organization previously, I felt empowered to advocate for clear masks during the pandemic at the organization. My journey from feeling isolated to becoming an advocate for access, educating pharmacy professionals on disability inclusion through panels, through presentations at school levels, at state level, at national level, and serving as a DEIA committee member of the American College of Clinical Pharmacy to inform about accessibility at conferences, to inform the policies to ensure that our profession of pharmacy remains inclusive. That is the way I'm able to lead with my disabled identity, to realize that disability identity is not a weakness, but this is the very thing that makes us powerful catalysts for change. And with that, I would love to hear from Dr. Mead.
My goodness, Kruti, you're bringing me to tears with your own story and recounting it. Thank you so much for sharing. I'm Lisa Meeks. I'm wearing a dark Docs with Disabilities Initiative jacket, and I have short blonde hair, and I'm wearing tortoise-shelled glasses. I use the she, her series of pronouns. The way that I lead with my disability, and I've never heard this question, I've never been given this question, so I love it. Thank you. I I think mostly it's about being very intentional about creating space for disabled clinicians and researchers to lead, not just participate in this work. And that means building structures that recognize the realities of being disabled and working in CRIP time, prioritizing access for all of our meetings, all of our events from the start, so no one feels like they have to fit in to a mold to contribute meaningfully. I think when Docs with Disabilities creates an environment where people can work in ways that honor their bodies and minds authentically, the work itself is so much stronger and richer and more innovative. So, in that way, I think I'm leading by creating this space and allowing this flexibility, which results in a better product and is more respectful of the full humanity of every contributor. And so, another way that I lead, I think, is by example. I am a disabled scholar. And so when I'm in a flare or I'm unwell, I take the time that I need to rest. When you work in a team where disability is central to your belief system and all of the principles of disability justice are practiced, you're able to do that without apology. So I'll step back and I trust my team to step forward. And that reciprocity, that willingness to give and take and receive support in our team, I think truly models accessibility. And it's a sustainable culture for me and many others.
Katherine, I'd love to hear from you.
Thank you. Hi, everyone. My name is Katherine Vakil. I use she, her pronoun. I'm a mixed race woman with shoulder length, curly brown hair and brown eyes. I'm sitting in my home office with a blurred background. So reflecting on this question of how I lead with my disability identity in healthcare, a lot of the themes that both my fellow panelists, Lisa and Kruti, brought up also resonated with me. I think for me, it really started with embracing my disability identity. I know at the very beginning of my career, I kind of kept that to the bottom. I didn't really discuss it at all. I was like, I need to work hard. I need to work 5 times harder than my non-disabled peers in order to be successful. So it really started with just embracing myself and coming out as my authentic disabled self in the healthcare space in my career. And it started with just the community of disabled people. So, for example, with Docs of Disabilities and Disability Lead, for example, that really gave me the space to just come as who I truly am. And then what I wanted to do was take that feeling of where and being in spaces where I felt safe and bring that into my own workplace. And I think that also started with sharing my story. So as I started to embrace my identity and who I was, that I started to share those stories and I started to realize that I had many colleagues, people that I work with, that shared those similar challenges and experiences that I did. And so I wanted to continue to put forth that with that energy of where we can feel safe. I feel like one of my favorite sayings is you don't really feel the burden that you have until you're in a space where you feel safe and you're just like, so that's kind of what I try to do now in my everyday world. So similar to Kruti, I am a pharmacist by training, but I'm more on the administrative side. I'm not seeing patients face to face, but I am working with many different colleagues in an interdisciplinary world. And I want to be able to show that we as healthcare providers, healthcare professionals, can be disabled and still be excellent healthcare providers. So that's one way that I show up every day.
Thank you, Katherine. We'd love to hear from Zoe.
Hi everyone, my name is Zoe. I use she and they pronouns, and I'm a white person with long, light brown hair and a tan sweater with a blurred background. Thank you so much, Kruti, for the question, and to Disability Lead for having us here today. I'm a newer member of Disability Lead, and I can't tell you all how exciting it was that becoming a member and having docs with disabilities, kind of engaging with Disability Lead at the same time, felt like such a just a beautiful moment of some of my favorite things coming together. I really like this question. And I think a big way that I lead with my disability identity is having conversations about disability in spaces where there otherwise wouldn't be. So, for a little bit of background, I am one of the leaders of the Docs with Disabilities Initiative. Incredibly grateful to be mentored by Dr. Meeks. I'm a researcher within the lab that Docs with Disabilities houses, and I've also done a lot of work on the transition of medical students to being residents or doctors who are still in training but are licensed, although still supervised. I also, though, do research and education on how we can better care for our patients with disabilities. And with the interest in both of those spheres, I've found that something I, as a disabled person, can offer is conversations about what disability is. What do we mean when we say disability? What is disability identity and culture and language? So, forcing us to step outside of disability as a diagnosis or a medical problem and actually think about and understand disability as a social and a lived experience. So I look for these moments, whether someone is curious about my mobility aids or the stool I use when we're rounding on patients in the hospital, if we're discussing accessibility for a patient themselves, or maybe giving a new diagnosis of disability, whatever the moment is, to share those small pieces of information about disability identity and culture. I really like taking this approach because even though I do offer lectures and broader, more formal moments of education. I think these small, real moments between two colleagues or friends or learners can have a really lasting impact. And when I'm vulnerable about my own needs or share my own disabled perspective on a clinical situation, it really allows for that pause where others are invited to think differently or maybe consider something they haven't in the past. And so I think sometimes leading is just as simple as being honest, being yourself, being willing to engage, and particularly in a space like healthcare, where a moment to consider the disabled perspective is really, unfortunately, not the norm.
Thank you. Wow, I'm having goosebumps just listening to that pure, authentic, heart-to-heart conversation. Thank you for your vulnerability and authenticity, all of you. So, with this is a power series, and Dr. Lisa Meeks is invited. We would love to know more about docs with disabilities. I want to recenter to the important work because all of us that we were connected is obviously through Dr. Meeks. And you being the founder, the co-director of the initiative, please tell us more about DWGI. How did you do it? How did it all start? And how it has grown to be this global platform?
Thank you. Well, it started, I was doing things in varied areas. So I just started my research career. I had been in private practice as a clinician. I had been a disability resource professional in the past. And kind of all of those things synergized to say there is this huge gap, a disconnect really, in understanding how to create disability inclusion and health professions education. And for me, it didn't seem like it would take much to fill that gap. But alongside that gap, frankly, there was this assumption by many healthcare educators and leaders that disabled people could not possibly be in medicine. And when I say medicine, I mean broadly pharmacy, PT, OT, nursing. At the same time, there was this early work, people that I look up to so much, Christy Kirshner, Lisa Iazzoni, where they proposed that having disabled providers could actually benefit medicine and contribute positively to patient care. But there was no real evidence to back that up. And in medicine, we love empirical data. So I wanted to change that by starting to create data in this space. And at the same time, I recognize that creating the data alone isn't really helpful. I think if we asked our audience today what the most impactful thing is in changing hearts and minds about disability, they would all say stories. And, Dr. Sheets talking about the little interactions that she has with individuals, I would argue are exponentially more impactful than any paper that we produce. But we do need all of these things to be in a space together, working together. So I thought, well, we'll start the research, and that was back in 2016. And then we need these stories to go along with it. So I launched in 2017. It's so weird to say that, the Docs with Disabilities podcast. And the goal of that podcast was to be a direct counter narrative to the assumptions that were out there, right? That people with disabilities could not be healthcare providers. And I knew that there were thousands of people living with disability and thriving as healthcare providers. And I wanted to find those and elevate those stories, give a platform for those stories so that we could actively combat the assumptions that people have. And important to my personal ethos and my research ethos, which Dr. Sheets and I share and recently wrote up for our website and for people to use, was that all of this work, if we were going to create this organization, that all of it had to be with the idea that it's for people with disabilities as well, and that it's informed by people with disabilities. So keeping all of that in mind from the very beginning, we thought we'll focus on three things: research, education. The education was very easy for me because it was what I had been doing for a very long time. So teaching faculty, teaching institutions about disability inclusion and storytelling. And on the research side, we've made incredible strides. I'm so proud of what we've done. And one of the things that I love, this is just kind of a little cheeky aside, is that people think that individuals with disabilities can't be as productive. Productivity is something that comes up a lot. And yet our research lab has produced almost, I would say 80% of the research on disability. And this year alone, we've produced, I think by year's end, we will have almost 30 publications. That is unheard of. So we are overproducing at this point. And what I tell people is when you have a team that is so connected, that is so focused, and where you can bring your authentic self, similar to what we just heard, that there's a safety there. You can get rid of all that energy, that cognitive energy, that emotional energy that you expend every day trying to navigate inaccessible environments, and you can thrive. And so our team really thrives on that research side. And we've been able to bring more learners into our system. We've examined clinical accommodations, explored intersectionality and equity, and all of our research is used then to translate to policy recommendations. Dr. Sheets has been a huge part of that on the policy side and on the research side. And now, as a senior researcher, is mentoring up. So we have a system where we mentor learners up through their educational pathway into training, and then they become PIs on our grants. We're also partnering with national organizations, all of the educational organizations like the AAMC, the AMA, the ACGME, AACN, AACP. I don't want to miss anybody, but suffice to say, we're partnering with all of the associations that are involved in health professions education to bring free and accessible training to their faculty and to their constituents. And the training that's being done is being done by disabled people, which makes it all, for me, just this amazing full circle kind of bucket filling work. We do webinars, curriculum development, all of those sorts of things. So I think mostly what I would say about Docs with Disabilities, we have the three things that we really focus on. But internally, we're really focused on building a pathway for future healthcare providers and to mentor them up. And so we do a lot of work on mentoring, making sure our environments honor access, honor crib time, and importantly, lean into collective leadership and collective care, supporting disabled clinicians and researchers and learners in whatever way or with whatever efforts they want to be involved. And I think, I can talk about Docs with Disabilities all day, and we only have so much time. But it's funny because I look at who's been with the organization the most. And out of that group, Zoie, interestingly, has kind of grown up in Docs with Disabilities, I would say. I don't want to speak for her, but she probably has some great insight as well.
Thanks, Lisa. As you can notice, there are so many hearts that were coming through the screen as when you're speaking, because testament to your such powerful, but also there's so much thought that went into this, and we would love to hear from Zoie, who is a member of the research team and committee chair. Can you please tell us a little bit more about how Docs with Disabilities supported your career?
Similar to Lisa, I could talk about that forever. And so when I was reflecting on this conversation, I really thought about my origin story with Docs because I think all of the examples I have are born out of this moment where Docs sort of shifted my perspective. I think the story captures not just why Docs with Disabilities matters, but also why representation and conversations like this and what the long-term impact of having inclusion is for bringing up, as Dr. Meeks often talks about, bringing up the next generation and mentoring up. I wanted to be a doctor since I was a toddler. I have no idea where that idea came from. I clearly had no idea what I was talking about, but it still didn't change. And so growing up and seeing my parents' health issues, and then in early adolescence, developing my own disability, I saw healthcare in a really intimate way. And unfortunately, what I saw were a lot of flaws within the healthcare system, ways that people were dismissed or harmed or didn't have access to what they needed. And this compelled me really strongly to become a doctor, to truly pursue the thing I had perhaps jokingly been saying when I was a child. And I came to college full steam ahead, pre-med, ready to go. And I was lucky to attend UIC actually before transitioning to U Chicago. And this was a school that had so many opportunities for a well-rounded education. And starting in my junior year, offered disability studies classes for undergrads. And these classes allowed me to deepen my own disability identity, to build a community, to understand who I could be as a disability scholar, but also to understand the depth of harm that's been caused against my community by the medical system, and sometimes the people within that system. And at the same time, I was beginning to struggle with my own symptoms. They were worsening with the stress of college, with having to navigate a large campus, with Chicago winters. And my grades were dropping, and I struggled with my MCAT, having to take it twice because I actually didn't get approval for accommodations initially. And all of this compounded into a moment where I realized I just cannot be a doctor. My body cannot handle this. I cannot do this, and I'm not qualified. It wasn't justified for me to join a community that I felt like was causing harm, and I hadn't yet seen an example of how that could be done differently. And so I took a step back and I pursued a master's degree, and I focused my master's of public health on primary care access for people with disabilities. And as I dove into this and the data bloomed in front of me, it was clear there was such a need for disability awareness in medicine. Fast forward a little bit as my master's program connected me to folks like Dr. Christy Kirschner, Dr. Ray Curry, Jay Mueller, people who were within the medical education department and were doing this work. They were committed to disability in medicine. I had no idea there were people doing this work. I didn't know this work existed until I started diving into this research. And with every conversation I had, everyone said, you have to meet Lisa Meeks and you have to listen to the Docs with Disabilities podcast. And I did. I reached out and we connected. And with every conversation I had with Lisa, with every podcast episode I listened to, with every paper I read, my doubt faded away every single day. And it actually became crystal clear to me that not only could I be a doctor with a disability, I should, because I am capable, because I can, but also because it's needed, because I had the capacity to get it in ways that other people couldn't. And Docs with Disabilities is what showed me that possibility, because there were so many providers before me that were willing to be vulnerable and to share their story. There was someone who had created a platform for them to do that. And they've continued to stand behind me and shape me as I've figured out not only what is it like to become a disabled doctor, to now be in my third year of being a disabled doctor, but also what does it mean to try to change the world so that the people coming after me don't have to have that same moment of doubt. It's just assumed and understood that we will be here too.
Wow, that was, thank you so much for sharing such a powerful journey. I caught myself tearing up because of that powerful story. So thank you again. And I can, your story is testament to so many people kind of, catching themselves saying, oh, I don't think I can do something that I'm set to do because of my disability, and hearing this story, having docs with disabilities to mentor this journey. I can proudly say that this mentorship was provided to me that really lifted all the barriers up and realized that clarity, that crystal clarity to help us navigate our path forward, and that we are important. Very beautifully said. And so I actually, from that example that you shared, we can truly see that Docs with Disability is centering the way in where disabled representation is there, whether that is medical education or other healthcare education, whether that is in practice, where patient-centered or patient-facing healthcare organization, or whether that is in research. And so what if we can maybe go around, maybe Katherine, if you can share more about how disabled representation impacts the patient experience and models of care, that would be lovely. We'd love to hear from you.
Oh, absolutely. I think this is at the core of what I truly believe in. It really does impact the patient experience and our model of healthcare and changes it for the better. Um, I think I think the most obvious thing that pops up is, having the shared experience of being disabled between the healthcare provider and the patient. It just leads you to being more empathetic and understanding as a provider. I think the way I think about it is it grounds you. It goes from me thinking I need to fix my patient or cure my patient to how can we work together to get what you want out of your life. And as a disabled provider, you really truly understand that at a different level compared to a non-disabled person. But like I alluded to earlier, my role is more administrative. And so I don't really see patients face to face on a daily basis. So I have the privilege of being in spaces where decisions are made that ultimately impact patient care. And so in any space that I'm in, I'm always thinking about disability inclusion. I always try to keep that in mind, whether or not it'll impact our patients, but also my fellow colleagues. So I truly love what Dr. Meeks and Dr. Sheets are doing because they are really focused on our learners and those that are becoming providers. But in my own story, I was a pharmacist for 7 years without having embraced my disability. So now I'm like, whoa, I need to figure out how to embrace that disability. So, and I know there's many colleagues and peers that are going through the same thing where they're keeping that part of them hidden. And so my hope is that with every decision I make or every thought that I'm putting out, is that I'm also allowing that space to bring those disabled providers that already exist in the world to be able to do the best work that they can. And that ultimately, for me, makes them a better healthcare provider and improves that patient experience. And so I think that's what's really cool for me for this panel is that we can really be leaders in all different areas. Sometimes we think, I can never be a leader. You think you need to be at like some top powerful position, but no, in every space you're in, whether you're starting out as a student, whether you've been working for 7 years and have never even talked about it before, or and then whether you're in like an administrative space or you're actually targeting or working directly with patients, you can make a difference. And I've seen that in my own work. So I started out working with patients directly. And then now in my administrative role, again, I think about when I'm in a meeting or when I'm working with my team, is my work or the way that I'm directing my team inclusive? Because we know that there are many folks with invisible disabilities. So I want to make sure that I have that universal accessibility top of mind for me. And then also when I'm working with providers or those that are making changes system-wide, am I thinking about my patient? We have so many wonderful resources in our healthcare space, but we know not everyone can even access it. So how do I even open those doors for my fellow disabled patient to be able to get access to it? So for me, it's that really like reframing your mindset and always thinking and also truly believing in your influence. You never know, even if it's one person, you've changed one person's life, and that's truly a beautiful thing. So that's one thing that I think about a lot.
Thank you, Katherine, for leading with that identity and from what I've heard, and the impact that you're making for medication access, and I'm a pharmacist, so I could, this medication aspect for vulnerable population is such a challenge. There's so many medications that are expensive, unaffordable, even though guidelines are recommending a medication, but so many patients that you and I are dealing with are unfortunately not able to have their barriers due to the different reasons, and to be able to work with the team to remove those barriers, to make sure that medications are available to our patients, whether that is financial access, transportation, all these other things that I, as a transitional care pharmacist, help with. It really is because of that disability identity that I'm able to lean in. Zoie, Dr. Sheets, we would love to hear from you as a medical doctor, about how, I know you shared a few examples about impacting learners, but we'd also love to learn about patient experiences and models of care.
Absolutely. I keep saying I love this question. I love all the questions, but I think the reason I love this question is because those stories, the patient care stories, those are what fuel me, right? Those are what keep me going. Because as much as I firmly believe that there should be disabled people who are doctors and pharmacists and all of the things, it's also hard. And until we have the transformation that eliminates the stigma and the bias that we face, it's always going to feel hard. And so having the patient stories, in addition to the communities like Docs with Disabilities or Disability Lead or wherever you find your people, having the patient stories is such an important way to come home at the end of the day and say, it's worth it. I've got this. This matters. And so I think of a few specific stories, two of which I'll briefly share. One was a young patient who lived with autism and had not really identified as disabled so much as just neurodivergent, but was dealing with a new life-altering disability diagnosis of paraplegia. And we had so many conversations, his family and I, of what this would mean. And his mom had told me several times that the conversations I was having did not mirror the conversations that other providers were having. And when I explored this with her, it became so obvious that what was missing in those other conversations that had been focused on deficit and challenge that was to come, the conversations I was having was, how do we find him disabled mentors? How do we make sure that he knows how to do fun things like wheelchair wheelies and things like that? Like how do we make sure that he gets to figure out who he is as a disabled person? And I don't know that I would have known that that was just as integral a part of the conversation had I not become disabled at the exact same age that this kid was experiencing what he was. I am a med peds doctor, so I see patients from the moment they're born until old age. And so that's a pediatric story. But I think of another adult patient I had that I cared for weeks. And she had such a constant progression in what was happening with her body, where we would be talking about one issue and then it'd kind of be something else came up. And as we were tackling one thing at a time, I would come back every afternoon and say, okay, let's break it down. Let's update our piece of paper where we're keeping track of things. And she finally asked me during week 3 where I learned to communicate with patients. And when I told her a bit of my lived experience, she looked at me and I'll never forget. She said, this might sound weird because I can't say that I'm glad that you have had the challenges you have, but man, am I glad you've had the challenges you've had because you get it. And that to me was this moment of, as much as I wish sometimes things hadn't been hard, I'm also glad that I've had the challenges I have because of the way that it's made me the doctor that I want to be. And that matters, right? Patients that can tell that their doctor gets it, whether it's race or gender or sexuality or disability, or really importantly, the intersection of some of those things. Doctors who get it can not only connect with their specific patients, but they can also transform the perspective of colleagues who are witnessing these conversations and seeing what it means to show up in a disability affirmative way.
Thank you, Zoe, for sharing those two concrete examples. I feel like when you were describing, I felt like I was in the room with you and the patient as you were talking through. Um, and with that conversation, what we're talking about, and this is a multidisciplinary, when we think about healthcare, providing the care to our patients, really understanding the barriers is what I feel that we all have been able to, and the way we're able to connect, the empathy. If I could take a moment and maybe share about one example as a inpatient psychiatry pharmacist. But psychiatry, as we know, is not, there's a lot of stigma associated with it. It's not just people don't just, have it in their history, be like, okay, PTSD, depression, substance use disorder. People don't normally like to or want to talk about it. And to be in that vulnerable, to be in an inpatient setting when patients are coming in, and to be able to connect with them, to ask them about their medications and make a discharge plan with them is something that, again, made me feel that I am with you. I understand what the stigma does to you. And so that's why instead of owning that and doing something about it, we end up, farthering it away from that diagnosis or medical condition, farthering it away. And so to be able to have that candid conversation and say, we have help, let's figure out how we can get help, how we can seek therapy. And really connecting the dots and removing the stigma has been really powerful experience for me. Lisa, I would like to pass the baton over to you for the next round.
I it's so interesting because you have this theory and I have this theory that's all patterned out, right, about the mechanisms and the pathways in which disabled people will impact healthcare at the end of the day. But then listening to the three of you talk about it really in the moment, the things that actually do happen is so powerful. Um, I I believe that disabled representation fundamentally changes the patient experience. I really do. And as your stories are kind of a testament to that, I do think when a patient sees a provider or connects with a provider, it doesn't have to be an apparent disability, but somebody that lives with disability, that there's this level of trust. And for those with non-apparent disabilities, you may not even understand what that is until you get into kind of a discussion with the provider, but there's something about this person that signals to you that they get it and that they're listening to you. And so I think it's really that trust, this sense that beyond the medical facts, the person is listening to what you're reporting, your lived reality, believing you. That's huge in medicine. And then acting on it, but making a plan with you because you are the expert in that space. And this trust, the understanding totally changes the conversation. I like to say it reduces that power differential with the medical professional almost immediately. And again, with that cognitive energy I talked about before, that where when the researchers come into our space, they don't have to do all of that guessing and all of that work emotionally. I think it's the same for patients. So patients don't have to explain or defend their experience or contextualize it in a way that's palatable to the healthcare provider. Um, and in many ways, you can start from a place of shared knowledge and respect. For Zoe, when Zoe's using a mobility device like her cane or a scooter, there's an immediate signaling to the patient. And I've been lucky enough to, as her mentor, hear so many stories. That was just two of countless stories, really, of the way that in these small moments, these 5-10 minute engagements, that she's changed someone's perspective or made someone feel seen. I think it also delivers powerful assumption busting information. So, delivering healthcare, improving healthcare isn't just about a disabled provider to a disabled patient. I think that having disabled providers in the space, sharing it with non disabled providers, is deeply impactful because you are challenging other clinicians' perspectives of disability and their impressions of who and what disabled people are. Many of you probably are aware of Lisa Iazoni's publication in the last year or so looking at the perceptions of providers, what they really think about disabled people. And it's insulting and it's heartbreaking, and it's challenging, and it's one of the biggest challenges we have. So having people with disabilities in that healthcare space as providers, not only good for patients, but really good for combating the ableism and the assumptions that live in that space. And those non-disabled providers with a new understanding or having had their ableism challenged can then provide better care or think more broadly, have more empathy. So I think that's another mechanism that's really important. And I don't think that it's, all about disabled providers and disabled patients that are disability specific. So it's not, Zoe has a chronic health disability, and that doesn't mean that Zoe needs to care for chronic health related patients, right? That there's something that's transformed about disability and just the experience that although each individual person with a disability is so different, they do share a lot of common experiences. And so that lens helps improve the system and helps improve care, I think, for everyone. So those are a few of the ways in which I think, or the ways in which the model that I've created is set up to impact that. And that's what we are looking to test and get empirical evidence on. We do know that empathy is higher for disabled providers, and that empathy stays high regardless of burnout. So we know that the majority of our healthcare profession are experiencing burnout at varied times in their career. But if you are a person who identifies as disabled, regardless of your burnout, the empathy is not eroding. And that's a really important finding from one of our studies. So I know the time has come. I'm a little bit nervous, I must say, because I'm supposed to ask you all how Docs with Disabilities has impacted your lives. But you made me cry at the beginning, and I'm not wearing waterproof mascara. So you probably noticed that I've been wiping my eyes. Now my eyes are stinging, and I'm terrified to cry again. I grabbed tissues because I've never actually, it's funny, I was sitting here thinking, I do this work I literally do. This is my life. And I'm so blessed. I'm so appreciative. But I get up and I do the work, and I don't often get to be in a situation where I'm hearing people in the same panel talk about the impact it's had. So it's moved me a little today in ways I had not anticipated. So I'm going to sheeply ask you how Docs with Disabilities has impacted the way that you work. And then I'm going to have tissues right here. If I turn my camera off, forgive me, but I'm a little scared at at your answers and how that might work. But maybe a lightning round from each of you, just really quickly.
Do you want me to go first?
Sure.
Okay. I'm happy to. It's hard to do it in 2 minutes, just as you mentioned that it's hard to do it, talk about Docs with Disabilities, but I'll try. I think I kind of captured what, Lisa, you're, connecting with you really broke down the wall for me. You broke down my I cannot to say, yes, I can, because of modeling with all these healthcare professionals. I can be really quick and brief and share in 3 ways what Docs with Disabilities has done. First of all, it helped me to connect with other mentors. And that's how Katherine and I, we both have our podcast, out there, our episode out there. We connected with other healthcare professional. I reached out to them to see, oh my gosh, I loved your story. I really love to, reach out to you and connect. And really, there's a lot of power in being together, in joining forces. So that joining forces is what I got from Docs with Disabilities. And to pass that forward, I know, Lisa, you're visionary, you're thinking about how we can take access in medicine and applied access in pharmacy. And I know that journey with access in pharmacy with you as a mentor, as a leader, is going to be powerful and great and much needed. The second avenue is education. I realize that there's a lot of, as every, all three panelists mentioned, that the barrier here is that there's not a lot of knowledge about how to handle, how to have disability inclusion in spaces. And so with this, I feel like I'm able to educate and have opportunities to talk about disability inclusion in workplaces as well as in pharmacy education. And then the last thing is advocating. Advocate for needs is what I got the courage for. I was scared to say, I need captions, I need clear maps, but now I think about if I am asking, somebody else is going to be benefiting from that. And so that courage is what I got from Docs with Disability. Thank you.
I think for me, I could not have made it more clear today. All the ways Docs with Disabilities has impacted me, and I will not rehash them all. But the last thing I will highlight is that as I have transitioned to being a leader within Docs with Disabilities, what that opened for me that I don't know I expected was a constant flow of learners coming to me and asking me for mentorship and guidance and advice in the same way that I got it from people like Lisa Meeks, Dr. Justin Bullock, Dr. Chris Moreland, Dr. Nalinda Transangave, all these leaders that have built me up in such powerful ways. And it's showed me the way that that constant ladder of building up and supporting, of knowing when to step up and step back, is such a critical tool for building inclusive healthcare. And I'm really excited to see how that's going to continue to transform when in just a couple of years, I'm no longer a learner and I'm just a doctor.
Yes, I will keep my comments brief. I think my fellow panelists mentioned a lot of what I was going to say, but one thing I think that's worth repeating is that it gave me again that space to be my authentic self and who I truly am. And then on a more like emotional, personal level, it made me feel less alone. Like I said, I think for almost up to like 7 years into my career, I really did feel lonely in my disability identity. But then I got to meet Kruti, another pharmacist who's hard of hearing. What? There's more people out there like me. It was like it really rocked my world, and I'm so grateful for that connection with Kruti and all of the people that I've connected with in the disability community. And the other thing is, it truly validated my experience as a disabled healthcare provider. Like there are days where it's hard, and that's okay. It doesn't mean that I'm a bad pharmacist. It's just a hard day, and I now have a community to lean on, and that truly again makes me feel less alone, and that's probably the biggest impact it's had on me.
Wow, what a great way to end the conversation. Thank you so much for sharing. Thank you, Disability Lead, for elevating, for bringing us together for such an important conversation. Thank you, audience, for coming and listening and actively sharing kudos. It was truly a pleasure to be in conversation with each and every one of you. And now I'll hand it over to Claire Kelly, Education and Learning Service Manager at Disability Lead, for closing remarks.
Thank you, Kruti. Hello, everyone. This is Claire speaking. As Kruti said, I'm the Education and Learning Services Manager here. I use she, her pronouns, and I'm a white woman with brown and gray curly hair. I'd like to wrap us up first by just extending a sincere thank you to our panelists for this incredibly powerful discussion. And it was so amazing to see the community that you've built together and with so many others being reflected right here in this virtual space. So thank you all so much. Thank you to our access providers, ASL Interpretation from AI Media and CART Services from Joe Gale. Thank all of you for attending today. A couple quick notes. If you are a Disability Lead member who registered for the exclusive meet and greet with the panelists in just a moment, you've been sent a personal calendar invitation with a link to join. So we'll see you there in a moment. If you're not a member, but you live or work in the Chicagoland or Southwestern Pennsylvania regions and identify as a person with a disability, please consider applying to join our member network for access to exclusive leadership development opportunities and support. Plus, we are now recruiting for our 2026 Institute, a year-long fellowship for emerging disabled leaders. Some of our panelists here have been a part of that program. You can click the link in the chat to learn more and apply. We also hope you'll find other ways to stay connected with us. Check out our stories and updates at disabilitylead.org and stay tuned for more information about our next Disability Power Series event coming up later this year. Lastly, before you go, please take a moment to complete our program feedback survey. It's being shared in the chat, but it will also pop up on your screen when this webinar closes. Thank you to our panelists. Thank you to our audience. I hope everyone has a wonderful day.